Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast that gets all the behind the scenes goss. Today I'm joined by Richard for a one-on-one chat to see what makes him tick. We cover a lot, from his proudest moment in his career so far to something he wished more people understood about plastic surgery, to a memorable moment from his very first surgery. As always, like and review, and please share Keeping It Real with somebody who you think would enjoy a peek into the world of plastic surgery. All right, welcome. Thanks for joining me.
Thanks for having me.
So we're doing an RB special today, getting to know the man behind the myth. All right, we're just going to be like a rapid fire kind of getting to know you questions from training to now. So
is there prize money?
Candor. Yeah, actually. What's one thing you wish more people knew about plastic surgery?
I wish more patients knew that this is not just something for vanity and not just something for rich people, that it's a type of surgery that benefits a wide range of people, and that they shouldn't feel that they don't deserve to have this surgery, or it's not warranted, or it's not validated, because it really does help people, and it really does make a difference in our patients' lives.
What is the longest surgery you've ever done? And also for context, what's like typical operating length for you?
So these days, probably the longest operation I would do is probably around 8 hours. So if I was doing a body lift and breast reduction, that can be up to 8 hours or even a little bit longer. One thing everyone always wants to know is like, do you have a break? So I can operate for quite long periods of time without having a break. But in that 8 hours, there's usually times where I can have some fluids, even eat something. Like, you don't have a break. It's not like I go into the tea room and put my legs up, but there is opportunity to feed and water myself. So 8 hours, kind of one of the longest operations I do, but it's also pretty standard. And you can't just go out and do it. Like, you actually have to have a level of physical fitness. If I don't do regular PT, can really take a toll. Going back to reconstruction days, like when we were doing breast reconstruction, if it was you're reconstructing both breasts and doing microsurgery, that maybe could have been, similar or even longer, maybe 12 hours. Some of the sort of trauma stuff that I did early in my career, replants of fingers and things like that, again, could be sort of 8-10 hours.
I think it makes sense that you'd need PT for that as well, because you're like so tense and focused as well. It's not even that you're just like on your legs or like doing stuff with your hands.
Yeah, no. So, I mean, obviously part of it is physical, but it's also mentally, like, you're thinking the whole time. You're thinking about staffing, who's in the room. You're thinking sort of what's going on with the anaesthetic, thinking what are your next steps, what's the next suture. The physical side is certainly demanding, but at the end of the day, I'm generally more mentally fatigued than physically fatigued, I'd say.
Can you share a memorable moment from your first ever surgery?
I actually do. I'm not sure if it was my actual first, but it was certainly one of the first. So I was my first registrar job as a plastic surgery trainee was in Tasmania. And, when you're a trainee, often the surgeon arrives late and they call and say, get started. So I was very, very junior. It was my first job. It was my first job. And it was removing a skin cancer from a lip. Now, lips are very, very vascular, so they bleed a lot. And there's always this sort of myth about putting adrenaline into an end organ. So everyone always used to advise you, don't put adrenaline with the local anaesthetic in a lip, in a nose, in an ear, in a finger. Turns out it's complete BS. You can happily use adrenaline in all of those areas with no untoward effects. Anyway, so surgeon hasn't arrived. He says get started. I know basically what to do because I had been a plastic surgery resident. I'd sort of been involved in lots of skin cancer cases. So I start doing this procedure and didn't put adrenaline into the local anaesthetic. And the surgeon walks through halfway through and it's a bloodbath. I'm covered in blood, patient's blood covered in blood. There's lips, there's like big arteries in the lips. So he walks in and goes, like, expletive deleted, but what the are you doing? because, there's not meant to be any bleeding in plastic surgery. And I said, I didn't put adrenaline in. He goes, why not? So anyway, got it under control, learned my lesson, became very, very proficient actually at cutting skin cancers out of lips, sort of worked out my own strategy to essentially have almost no bleeding whenever I used to do it. Anyway, so that was a fun. Oh, and he also, which probably wouldn't get past HR these days, he made me stand there covered in blood and took a photo of me for old time's sake. This is back in the days, School of Hard Knocks, where, it was fun to belittle a trainee.
Are there any surgeries that you find particularly challenging or satisfying?
To a greater or less extent, every surgery is challenging because there's so much at stake. Patients are coming to you, they want to have the best possible outcome. Apart from managing the surgical outcome, like it's still a patient on an operating table and other stuff happens. So in a sense, every surgery is challenging, and probably they're also all satisfying, particularly in the area that I work, because I just working doing operations that I like. I've almost cut out every operation that I don't like. So, different aspects when I'm doing a body lift and sort of everything comes together, and what the patient looked like on the table before, and there's so much extra skin, and they sometimes, parts of their lower abdomen is sort of rolling onto the table, and then at the end you've got this very shaped body. That's very, very satisfying and rewarding. A breast reduction, we just did a breast reduction last week on a young patient, removed 1 kilo from each side, and you can imagine, like, her breast shape before, there was no breast shape. We actually just saw her then, and interestingly, one of the first things, just look how long my torso is now. So, you see that transformation on the table. That's amazing. And now with the face surgery that I'm getting into, I'm really enjoying that. See the changes that you've made. I really enjoy all of the work that I do.
Have you ever had to turn down a patient?
Regularly. Yeah, people know I'm not operating on patients who are overweight. You have patients as smokers, I won't operate on them. And then, there's sort of a more vague group who are just completely unrealistic in what they're trying to achieve. They're obviously the harder ones to pick because, you only meet someone for an hour. So sometimes I'll defer that if I'm a bit concerned that they're unrealistic, and I'll, recommend a second consultation with me to go over a plan again.
Do you have a particularly touching or memorable patient story?
Oh, there's just so many. All of the cards, all of the hugs at the end of a surgical journey where patients are just so overwhelmed with what we've done. There's too many to sort of go through. We often talk about plastic surgery compared to other specialties. If you're going to see an orthopedic surgeon or a neurosurgeon or colorectal surgeon, you're generally going there because you have to. You've got a bowel cancer, a fracture, whatever. Patients come to see us because they choose to. And it's a big distinction, and it's an honour to be able to do this sort of work.
Have you ever had a patient surprise you with their transformation?
Yeah, sometimes, I'll see a patient post-op and I've been able to achieve a result even better than what I thought we were going to be able to achieve. And, some of those things are a little bit unpredictable because it comes down to, tissue elasticity. And also, we can only achieve what we can achieve. There's also lifestyle aspects that impact the final result as well. So, once we've done our work, sometimes patients then get much more motivated with diet, exercise, healthy living, and it just then improves the results even more. So there's that group of patients. And then there's also the patients who, generally the massive weight loss patients where they've lost just so much weight. And we were talking about this just the other day, and you see the result and you look at the result and it's not sort of the same end result as maybe a young mother who's had a maybe a couple of large babies, and you look at it and you think, oh yeah, the skin's just not quite as tight, or there's still a little bit of loose skin. But then you look at the before photos and it's actually extraordinary, and it's hard to actually imagine how those patients were able to function and do basic things and exercise, troubles with clothing, all of those things that people talk about. So sort of, it's not necessarily just the final result that will not surprise you, but that you're impressed with. But it's maybe how much people have improved as much as sort of just the end point.
What's the most unusual case you've worked on? And I feel like probably we have to throw it back to training.
There was one case. He was an old farmer, and I think he'd had a basal cell cancer, which is generally quite a benign tumor, but it was on the top of his head, and he neglected it for years. And the other name for a basal cell cancer is a rodent ulcer, because they don't spread, like metastasize like a melanoma or breast cancer or those sorts of cancers, but they just keep on burrowing in. And this had eroded into his skull. It had eroded into the main blood vessels in his brain. It eroded into his brain, and it had a very, very complex reconstruction. But it had obviously impacted him because, there was sort of some significant mental impairment after, because it had been left so long. But that was a pretty unusual case.
Deeply distressing. I was like, wait, no, it wasn't the maggot one, Kim, but that was a different story.
No, it was a different story.
How powerful denial is.
Yeah.
Like sticking his head in the sand and like just hoping it'll go away.
The other unusual cases, and like they all mainly go back to training. The stuff I see now is not so much unusual. It's pretty predictable. There's a terrible, terrible skin infection called necrotizing fasciitis, and I had to deal with a few of those patients when I was a junior consultant, and they were just horrific. So it's that flesh-eating infections. It would just progressively go further and further up a limb, and you're just trying to stay ahead of it and also treat it with some hyperbaric oxygen. And there's one particular patient, I think I was so traumatized after that I declined being involved ever again. I don't think there was anything major. Like it might have started just as a cellulitis. Like I don't think there was anything, weird like being bitten by, a strange animal. There's nothing like that. It was something pretty innocuous, and then it just sort of took hold.
What is the most stressful part of your job, and how do you handle it?
So many parts. Where do I start? I think it's just a combination of everything, because we're doctors, we're dealing with patients, we're also dealing with hospitals, you're dealing with all the staff at the hospital, and then at the same time you're also trying to run a business and look after staff that you're responsible for as well. So trying to juggle all of those aspects. I can keep it mostly under control as long as there's sort of less than 3 fires going at the one time. But there's a lot going on all the time. But, as I always say, sort of, once you walk into the operating room, it's like playing footy. When you go over the white line, you're fully fit and you've got to be focused. And as soon as you walk into the operating room, you've got to blank it all out, not think about it. It's kind of a benefit in a way of being in theatre, because you are a bit protected and you've just got to focus on the job at hand. And once you put the last stitch in, then you have to deal with all the other stuff.
Are there any surgeries you won't perform no matter what?
Talking technically, like I've been and done rhinoplasty. I think it's a very challenging operation. Really respect anybody who does it and is really good at it. I think there are some great rhinoplasty surgeons out there, but it's difficult to sometimes get patients to a position where they're happy with the result, even though it's a great result. I don't do skin cancers, and so there's sort of some areas of surgery I don't do. I suppose within the area that I work, so body contouring, I don't do BBLs, Brazilian butt lifts. So that's where people take fat and inject it into the buttock. It's got an incredibly out of proportion mortality rate, which is, I think it's less than 1 in 5,000 patients die. So they're not odds that I really want to get part of. So
and out of proportion results.
And great call, out of proportion with, the benefit of the surgery. I'm not sure. You'd have to have an operation that had unbelievable upside to take on that sort of risk.
You know, you've had patients come in here who are like, I don't know, I feel like for a BBL, actually a surprisingly good result, and they still hate it. And I'm like,
Yeah.
what did you think was going to happen on the
Yeah.
other side? It's very confusing to me because it's like, okay, but what was the end
Yeah,
goal?
I did. I had a patient earlier this year. You're right. Who like for a BBL, like a BBL is meant to make your bum bigger, and it had made her bum bigger, and she then wanted to have it small. So I think the other problem with that operation that it is a bit of a trend. Definitely being asked about it way less. I don't see it come up in social media as much anymore. I haven't had a patient ask me about it probably for years now. My other rule is to not do an operation that you could actually achieve a similar result through diet or exercise. So for some patients that is liposuction. So if someone comes in and they want liposuction and they actually just need to lose a couple of kilos, then I'll tell them just lose a couple of kilos. Then if there's anything left, then I'll do liposuction.
What's the proudest moment of your career so far?
So much to choose from. I think probably setting up this practice. I'd been in 2 or 3 different practices and learned things all along the way. But this has really been the amalgamation of everything that I've learned in terms of patient experience, in terms of services provided, in terms of the actual physical environment, in terms of the staff that we hire and how that all works, how we manage the patient journey. So I think this is and that comes then with the surgery that you do as well, because it's all aligned. I take a lot of pride in having built this practice up from nothing, nearly, I think, coming up to 8 years ago. So yeah, I mean, that's been really good.
What advice would you give to somebody who wanted to get a start in plastic surgery?
So a doctor to get in, probably varies over time, depending on what's going on. Sometimes the advice is choose something else, do anesthetics. But I think, obviously, we've talked about before. I was very involved with training, and I do love the profession. But my advice now, which I probably wasn't given so much when I was going through, and to a certain extent the specialty has changed, is to, during your training, get as broad a training as you possibly can, but then have a view to what you want to do long term, and then really focus and subspecialize in that area. And then I think just all the normal things like, be yourself, establish a practice around your values and how you want to run things. Focus on one area that excites you and become the best at that as you can be, rather than trying to be everything to everyone.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.